Hello everyone, welcome back to Nutriverse Academy. So previously we have discussed about the first chapter of assessment of nutritional status, where we covered anthropometric measurements, clinical, biochemical and diet surveys also. So if you have not checked it out, just go and watch the video. And this is the second chapter of the second unit. Okay, so that is liver and renal function test. That means what type of common test and what type of and how the test, why the test and how the tests are done. Those are all explained in this video. And one thing I need to be clear, that you need to learn the value ranges, the normal ranges between the men and women, that should be also learned. Okay, so here I won't explain those type of normal ranges, where you will get these normal ranges according to the hospitals. Okay, so and also you can get it from the biochemical parameters. That is what we call, right? So yeah, so firstly we have to know about the liver function test. Okay, so what is meant by this liver function test? Generally it is a blood test which helps to assess the health and functionality of the liver by measuring levels of enzymes, proteins and bilirubin. Right, so if a person is suffering with a chronic, acute, or if a person had a liver injury, if a person had a liver infection, then these type of tests were done, so that to know the enzymes, how the enzymes are working, how the proteins are working in the liver, and how the bilirubin is working in the liver, and these are the main things, right, that our body functions. So to know that, these tests were done. Okay, so what are the common liver function tests here? One is alanine aminotransferase, ALT, we'll call it as ALT, and next one is aspartate aminotransferase, next is alkaline phosphatase, next is bilirubin, albumin and prothrombin type. Okay, so what this alanine aminotransferase does? So generally it is mainly used, this test is mainly used to evaluate whether the liver is injured or not. So we'll get to know with that, with this type of test. Okay, and the next next is aspartate aminotransferase, that is mainly used whether the liver is damaged or whether it, like, is it a less specific, or it is working in a very low functional, or whether the liver is damaged or not. Then we'll know with the help of this aspartate aminotransferase levels. Okay, and the next one is alkaline phosphatase. So in alkaline phosphatase, generally it is used to know the bile duct problems, like, or if a liver had a problem, and how the bile ducts are performing, and if the high levels are increased, then it may indicates the bile duct problem or a liver problem. Okay, so for that alkaline phosphatase is used. And the next is bilirubin. Here the total and direct test were done. So generally bilirubin is a enzyme, right? So increased level, if the bilirubin is increased, then we'll get jaundice. That indicates the liver is ability to excrete waste more, right? So if the bilirubin is increased, then we'll get the jaundice. How the jaundice were detected? Through the bilirubin test. That means it is done with the liver function. It comes under liver functioning test. And the next one is albumin. So these albumin mainly used to, like, why this albumin is done means, this test is done means to know the chronic liver disease. If the chronic means it is a long term health problem, right? So to know that problem, if it is a very low level, if the albumin is very low level, then it suggests that it is showing the case of chronic liver disease simply. Okay, and the next is prothrombin time. So prothrombin time is nothing but, as you know, prothrombin is a blood clotting time, right? So liver makes clotting factors, right? It is a prolonged prothrombin time which indicates liver dysfunction. Directly it indicates liver dysfunction. So if a person is a drunk addict, if a person is facing with a liver damage, if a person is facing with a liver dysfunction, then these type of tests are included in the biochemical or clinical test. Okay, so that is why this liver test is used to know the functionality and health of a liver in an individual. So that is about liver functioning test. Okay, and next coming to the renal functioning test. So as you know, renal functioning test is nothing but a kidney, to know how the kidney is performing, right? So it is mainly used to evaluate how well the kidneys are working by measuring urea, creatinine and electrolytes, right? So mainly what the renal does, it filtrates waste and it excretes from the urine. So here the common RFTs are blood urea nitrogen, serum creatinine, and next glomerular filtration rate, urine analysis and electrolyte. So what does this common RFTs, that means renal functional test, does? So in blood urea nitrogen, this test is mainly used to know how the kidney is functioning. Okay, it's to know how the kidney is functioning. So generally if the levels were increased, then that indicates it's a poor kidney function. Okay, and the next one is serum creatinine. It is mainly used whether the filtration rate, so how the filtering of the kidney is done. So for that the serum creatinine test is done. And the next one is glomerular filtration rate. So generally it is mainly used to calculate the how efficiency the urine is filtered in the kidney is mainly done through this glomerular filtration rate, commonly called GFR. So it is mainly used to calculate value which estimates kidney filtration efficiency. Okay, and the next one is urine analysis. So it mainly used to know the protein detection, blood glucose and infection in the urine, right? So if we have any infections, if we are undergoing with a diabetes, if we are undergoing with a blood or glucose levels, then these urine analysis were done. Okay, and the next one is electrolytes. So we have to know how our sodium, potassium, chlorine and also hydrogen carbonate, these are all sodium, these are all have to be done in the electrolytes itself. We have to know whether our kidney is causing any issues, or if there are any imbalance of the sodium, chlorine and potassium, then through these electrolytes we are get to know. So this is how the renal functioning test is done. So mainly it is used to detect kidney diseases, like if the person is having acute kidney injury or chronic kidney injury or chronic kidney disease. Okay, and it is also used to monitor patients with hypertension and also with the diabetes. Okay, so it is mainly used for the guiding medication dosage, and also as we are a nutritionist students, so we will know what type of foods to be included, foods to be avoided. According to these tests, these biochemical parameters will plan a diet. So this is what the second chapter is, liver and renal function test. So we'll meet again with the another chapter by the next Wednesday. Okay, so thank you everyone. Please do like, share and subscribe to my YouTube channel. Thank you.